Well, it affects your whole body. A bowel disease that you can't control or get rid of. It affects my whole life.
For Emily, it was meant to be the end of constant pain, a long-awaited operation to ease her Crohn's disease, due on Monday, now cancelled because of the strike.
And I totally understand why they're doing it, but it's people's lives that they are messing with, including myself. And if I don't get this surgery, my disease is only going to get worse. And I'm just so worried.
What do we want?
Pay restoration!
This was the last time we saw doctors out on the picket line, days before the general election. Now, a year since Labour won power, up to 50,000 will be out again, demanding better pay, but against a backdrop of waning public support.
So this is a crushing blow for patients and the NHS, and the strike is unnecessary, and actually, in my view, it's irresponsible and reckless. The thing that they should do is call off the strike and get back around the negotiating table with the government.
Let me just see if I can get through to...
The previous strikes compounded pressures on an already struggling NHS. This time, NHS bosses are urging hospitals to keep routine operations running.
The previous strike period, in total, about 1.5, almost 1.5 million appointments had to be rescheduled or cancelled. So we are very keen, having learned from that experience, to minimise the cancellations as far as possible.
Unlike before, patients too are being encouraged to continue coming forward for care by attending any planned appointments unless contacted to reschedule, with priority given to those with the most pressing health needs, and with A&E remaining open. The advice to still call 999 for emergencies and 111 for urgent but non-life-threatening situations. But the doctors' union, the BMA, is accusing NHS leaders of spreading senior doctors who will be working too thinly, and says its pay demands aren't being taken seriously.
None of the strikes need to go ahead if the government actually would negotiate on these things. We've had 21% of our pay eroded since 2008. All we're asking for is not a pay uplift, we're simply asking to have that returned to us because we're not worthless.
The government says there's no more money. The two sides seem as far apart as ever.
So, Sedge, it's obvious that this dispute is in deadlock, but at the centre of all of this is patients.
Yes, the talks have broken down. The government says the strikes are unreasonable, and patients will probably be thinking, here we go again. And the latest polls are showing that actually public support for the strikes is waning. We'll find out tomorrow exactly how many resident doctors walk out and join the picket lines. We'll also find out over the course of the next 5 days of the strike how many patients will be affected with cancellations and delays, despite NHS leaders saying that they're working to mitigate all of that. But patients will be hoping that both sides, both the government and those representing resident doctors, come back to the negotiating table, resume talks and try and resolve this dispute as soon as possible. But tonight, there seems to be no sign of that happening.